Welcome. I'm Carrie Gillespie, Project Director for Early Development and Disability at New America. This is the second forum in our series, the Advancing Disability Access Forum, which brings together people to discuss challenging problems and elevate new solutions in order to meet the promise of the Americans with Disabilities Act, or the ADA. New America's disability work aims to encourage policymakers to make better choices, to make good on the promise of the ADA, to strengthen economic self-sufficiency, independent living, full participation, and equal opportunity for all disabled people. More than 1 in 4 adults in the United States has a disability, and so all policy choices affect disabled Americans. All policy is disability policy. Today, we're discussing the policy decisions leadership has made over the past year in the U.S. Department of Health and Human Services, or HHS, and how that aligns with the promise of the ADA. The mission of HHS is to, quote, enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services, end quote. Over the past year, new HHS leadership has failed in that mission. They have sown public doubt about medical facts, created chaos through contradicting messages, compromised years of invaluable research, and fired or pushed out scores of experts who stuck to their oath to do no harm. People with disabilities have always faced disproportionately high barriers to high-quality healthcare and human services. The actions over the past year have further fortified those barriers. So where are we now, and what must change in order for the U.S. to provide the healthcare and human services that people with disabilities deserve? We have an excellent panel here today to discuss this, led by our moderator, Lily Heigl. Lily is the Director of Policy at the Association of University Centers on Disabilities. She was the 2024 to 25 Joseph P. Kennedy Jr. Foundation Public Policy Fellow, during which she worked for the Senate Committee on Health, Education, Labor, and Pensions on a broad range of issues affecting disabled people and their families. Prior to that, Lily was a disability policy analyst right here at New America, and she also worked at the Office for People with Developmental Disabilities in Albany, New York. Please welcome Lily.
Thank you so much, Carrie, and thank you to everyone joining us today. It's really good to be in conversation together and also back at New America. My name is Lily Heigl. I'm a white woman with long brown hair. I have on today a purple sweater and a white collared shirt that's probably obstructed by my hair at the moment. And I'm the Director of Policy at the Association of University Centers on Disabilities. We are the national representation for the National Network of University Centers for Excellence in Developmental Disabilities, or UCEDS, Leadership, Education, and Neurodevelopmental and Related Disability LEND programs, and Intellectual and Developmental Disability Research Centers, or IDDRCs. I want to take a moment to recognize first that we are gathering during Black History Month. This is a time to honor the leadership, resistance, and brilliance of Black disabled advocates whose work continues to shape our movements and our understanding of justice. Their contributions ground us in this moment and remind us why these conversations matter. Over the past year, we've seen profound shifts at the Department of Health and Human Services, too many for us to cover in our short time together. So during this conversation, our panelists will highlight just a few of those seismic policy changes coming out of HHS that, combined with harmful rhetoric, are dangerous to people with disabilities. Our goal today is to look squarely at what these changes mean on the ground for disabled people, for caregivers, and for families trying to navigate a system that is becoming more fragmented and less accessible. We're fortunate to have with us an incredible panel of advocates and policy experts who are deeply embedded in this work every day. Mia Ives Rubley Tori Cross, and John Poulos. So to get us started, the Americans with Disabilities Act, or ADA, turns 36 this year. Yet 2025 saw a rapid overhaul of US healthcare through the One Big Beautiful Bill Act and significant changes at the Department of Health and Human Services, or HHS. So, panelists, I'd like each of you to introduce yourselves while answering the first question so we can get to know you and your story better. While providing your introduction, can you speak to the current climate we are in? And from your vantage point, what is the single most urgent threat that these changes pose to the health of disabled Americans right now? Tori, we're going to go ahead and send it to you to get started.
Hi, thank you so much. So I am Tori Cross. I use she, her pronouns. I am a white woman with shoulder length red hair, and I'm wearing a white shirt and a red cardigan in front of a white wall with some art on it. I am the Associate Director of Federal Policy and Government Relations at Caring Across Generations. I'm also a disabled person, and my husband provides the support that I need to be able to do this job as well as take care of my daily functions and needs. Caring Across Generations envisions a world in which care in this country is accessible, affordable, and equitable so that everyone can live, work, and age with dignity. And we bring together older adults, disabled people, family caregivers, and care workers to win affordable, accessible care at every stage of life, including aging and disability care in our own homes and communities, childcare, time for care and caregiving through policies like paid leave, and good care jobs with the ability to form and join a union. We are in a climate where the programs and policies that serve our community are not only undervalued, but are actively under attack, and where the legislators gutting our programs know that it hurts disabled people and our families in our community broadly, and they are proceeding with these attacks anyway in order to fund tax breaks for the wealthiest and big corporations and help finance a mass deportation and detention agenda, which is in itself a disabling ongoing event. We are in a climate where disabled people and our lives are seen as less than by this administration and by too many members of Congress. And that devaluation of our lives means this administration and too many in Congress see spending on the policies and programs that support our lives, our independence, our autonomy as waste. The largest example in the last year is the passage of H.R. 1, which also known as the One Big Beautiful Bill Act, which got in more than $1 trillion from Medicaid, Medicare, and the Affordable Care Act, or the ACA, which also imperils our autonomy, our self-determination, and our lives themselves. Regardless of what some members of Congress have claimed, it is impossible to gut $1 trillion from the program that covers the health and long-term care needs of nearly half of all disabled people and more than half of children with special health care needs without hurting us. So that's really the climate. That's just one portion of the climate. We know there are so many attacks on people with disabilities happening right now, but that is really the threat that Caring Across Generations is focused on.
Thank you, Tori. I think that tied in really nicely with Carrie's earlier point that every policy is a disability policy. And so these cuts and changes, even if in the broader political climate, aren't seen as acts of violence against the disability community or harming the disability community, they're impossible to separate. So thank you for that. Mia, let's go ahead and send it over to you.
Hello, my name is Mia Ives Rubley. I am the Senior Director for the Disability Justice Initiative at the Center for American Progress. I work at the Center for American Progress is a progressive think tank that works on a wide variety of issues, and I get the honor to head the team that looks at disability policy. And as was just stated, disability policy impacts everything. So, sort of a jack of all trades here, or Jackie of all trades. I just a quick description of myself. I have short black hair. I have a white sweater on, and I go by she, her. And I think one of the things that I like to do when I'm introducing myself is state that, I am an Asian American disabled transnational adoptee. And so a lot of the impacts that are happening that have increased in the last couple years affect a lot of the different parts of the communities that I am involved with and love and care for. And so, I will say one, I'm a proud ADA generation. Uh, so that is a term that was lovingly created by Rebecca Coakley, which basically describes the generation of people who got to grow up with the knowledge that they had basic civil rights and that there was an infrastructure to ensure that those rights were protected. Was it perfect? No. But it was a starting point, or what a lot of people like to call the basement floor. But I think for me, it's been very interesting to see sort of, I was in kindergarten, I think, when the ADA was signed. And then to see, a real push towards trying to integrate disabled people as I was growing up and to see my parents spend so much time fighting for my own rights was very influential in the reasons why I got into the work that I do now. And it's been very interesting to see sort of the opposite happen very recently, and to see sort of history kind of repeating itself. And a lot of the work that I've been doing lately has been sort of reflecting on history and how things like ugly laws and eugenics all reflect on a lot of the things that we are seeing now. So the things we are seeing now aren't new. They are things that have been utilized in the past against disabled people to keep them out of communities, to try to eradicate us. And, it's frustrating to see that it's happening now, but I feel really honored to have been able to experience what I've experienced, gotten to get to where I've gotten, and be able to be on the front line trying to fight for the rights of disabled people, utilizing a lot of this cross solidarity work that is being done amongst a lot of the communities that are facing barriers right now.
My Wi-Fi cut out for a quick second, so I think I lost the end of Mia's sentence. Mia, can you give a nod or a thumbs up or something to let me know that you did in fact finish and it is me? Awesome. Okay. So sorry about that. I think I only missed about 5 seconds. John, would love to hear from you.
Yeah, of course. My name is John Poulos, pronouns he, him. I am a white man in my mid to late 20s with beard and short, curly brown hair. I'm in a bluish gray shawl sweater, and with a blurred background. Um, I'm an autistic man. I was diagnosed at the age of 5, and I am a senior policy advisor at the Autistic Self-Advocacy Network, which is a disability rights national grassroots nonprofit run by and for autistic people, furthering the movement and values of disability rights. And, it's interesting to hear Mia talk about being a member of the ADA generation. may be dating myself here, but I've never known a world without the ADA or even without Olmsted for that matter, just barely. Um, I got to grow up having an IEP and later a 504 plan. The ADA enabled my accommodations in college and still protect me in my workplace to this day. And now here I am working on these issues, whether it's through long-term services supports policy or healthcare broadly, autism research, and I'm seeing all the things that I got to benefit from growing up under attack. And so when we talk about the climate, I have to agree with Tori and with Mia that we're in a eugenic climate right now. I'll just call it what it is. It's not new. Um, Even before this administration, what is it, 31 states in DC still have forced sterilization laws. Institutionalization still remains a rampant problem. But what we've seen with this administration and with this Congress is a open armed willingness to embrace eugenics in their policy. Um, Tori mentioned how members of Congress and the administration insist HR 1 and the cuts to Medicaid won't hurt people with disabilities. It does. It will. The framing from the Secretary of Health and Human Services of neurodevelopmental disabilities like autism as chronic diseases, proponents of the anti-vaccine movement being in control of the Advisory Committee on Immunization Practices and the Interagency Autism Coordinating Committee. That's relatively recent news, and how that endangers the immunocompromised. Or even 10 days into the president's administration, where he blamed the accident above DC airport between a plane and a helicopter on people with intellectual disabilities. So this climate of eugenics and what this means, we're even seeing it now with the resurgence of the Texas v. Kennedy lawsuit challenging the integration mandate under the 504 rule, threatening Olmsted. And what that means to me is that there isn't just like one single threat for people with disabilities and our health. It's really the attitude and the beliefs and the values of the people in charge, and removing through staffing cuts and culture change in the administration and at HHS to get rid of anyone who's been fighting for us and fighting for our beliefs. And yeah, we're going to see this through the dismantling of our rights and through the inaccessibility and lack of enforcement of what's currently on the books. And that is, people are going to feel that and continue to feel that in their everyday lives, one way or the other.
Thank you so much for that, John. We've touched on a couple times now, HR 1 also going by the One Big Beautiful Bill Act as it was named. So I'd like to spend a little bit more time there. The One Big Beautiful Bill Act has introduced $1 trillion in Medicaid cuts. It shifted eligibility checks to every 6 months. There's also the rollback of staffing standards. So, Tori, this question's for you. For millions of disabled people and caregivers who rely on home and community-based services or HCBS, how do these changes threaten health and well-being?
Yeah, thank you so much for this really important question. It's something that we know, um, something that we know the like American public is not familiar with is that Medicaid, not Medicare, I'm going to say it again, Medicaid, not Medicare, is the primary payer for all long-term care in this country. Um, and more than 7.8 million older adults and people with disabilities rely on Medicaid home and community-based services, also known as HCBS. We also refer to it as aging and disability care, because most people don't know what HCBS means. Medicaid dollars pay the wages of direct care workers. They pay for some family caregivers to provide care at home across this country, which is often what people with disabilities and older adults receiving care at home want. They want to receive that care from their family members, and their family members should be fairly compensated as care is work. Meanwhile, paying for long-term care out of pocket ranges from $66,000 a year for 40 hours a week of care to $288,000 for 24/7 care. So those are folks who are needing the highest level of care. That's often people who have ALS or who have Alzheimer's, who need 24/7 care. This leaves us in the position where only the wealthiest people in this country can truly afford care without Medicaid. However, states are not required to cover every Medicaid enrollee with HCBS needs like they are for Medicaid enrollees who want nursing home care. What that means in practice is states can create wait lists, they can create caps on the number of people who get home and community-based services, who get care at home. And when federal Medicaid funding to states is reduced, states are going to make cuts to those optional programs every time because they're required under federal law to provide care to provide services that are mandatory to every Medicaid enrollee for those mandatory pieces. We've seen this historically during the Great Recession, which was the last major economic downturn prior to the start of the COVID-19 pandemic. Every single state and DC cut some amount of their home and community-based services. That included reducing the number of hours. That included reducing payment to providers who are already some of the lowest paid workers in the nation. That included lowering the number of people in the state who could receive services. And that really all translates to people with disabilities and older adults being forced to go without care or rely on unpaid family caregivers or be forced into institutions that they often do not wish to be in. You'll see and hear a lot of rhetoric saying the Medicaid cuts don't start until 2027 or later on for some of the big pieces. But for people who rely on home and community-based services, states are already cutting their Medicaid dollars toward home and community-based services. There are at least 3 states, North Carolina, Colorado, and Idaho, that have proposed significant provider rate cuts and significant other cuts. I'd like to focus on Idaho specifically because Idaho is proposing proposing the potential that they would remove all of their home and community-based services in the entire state because they're required to balance their budget. They just lost an enormous amount of federal Medicaid dollars, and home and community-based services are both optional, and the largest pot of money is that optional funding. Or the largest pot of optional funding is HCBS funding. So we are talking about an entire state possibly losing the services that people with disabilities and older adults rely on through absolutely no fault of the people with disabilities living in Idaho and living in that state. And there are similar considerations happening in every state because of this optional nature of home and community-based services. So for the millions of people who need care to live, age, and thrive in dignity in their own homes, this loss of Medicaid HCBS is catastrophic. It will force family caregivers out of the workplace so that they can provide the care that their loved one needs. It will continue to exacerbate the difficulties with turnover for direct care workers because they are already incredibly low paid. They have limited benefits. It's very hard work often. And so more and more direct care workers will leave the workforce, which exacerbates the issues with trying to access care. And again, it means that people will be forced into institutions, and there will be people who will lose their lives because of these massive, massive Medicaid cuts. I did want to note HR1 included many other provisions that also directly harm our communities. One of those is the rollback of staffing standards in nursing facilities. What the federal government is doing is saying that people with disabilities and older adults who are in nursing facilities don't need to have at least one nursing visit every day. What that means in practice is there are disabled people of all ages who are not receiving the care they need and who often didn't want to be in that setting anyway, but they lost access to care at home. And so they've lost their independence and autonomy to live in their own homes, in their own communities, and now are forced into nursing facilities or other institutions where they're not even receiving adequate care. There is no way to look at this other than to say it's imperiling the lives of people with disabilities and older adults through many mechanisms. I'll pass it back to you, Lily.
Thanks, Dory. I just keep thinking about how as advocates and the disability community and many other communities were raising the alarm about HR1 a year ago and saying what these harms were going to be. Feedback that we kept hearing was that this wouldn't impact, in quotes, those people. We want those people to get care. It's the fraud rhetoric, and I'm just struck as you've walked us through or explained just how tangible these harms are going to be, and that it's exactly what the community was raising a year ago. It's impossible to separate that out, and how devastating that's going to be. Mia, your work centers on the intersection of disability justice and federal policy. And right now, those two worlds are colliding in a really profound way. On January 5th, HHS and CDC officially changed the vaccine schedule for children. Simultaneously, we've heard a rise in rhetoric that characterizes disability and chronic illness as individual failures. So, from your perspective, how do these changes and others undermine civil rights of disabled people?
Yeah, thanks for asking. And this is Mia. I It's been very interesting to me going from sort of when we were in the full depths of the pandemic to now. And I say that because I know this is probably a little naive of me, but I was hoping that we could utilize that time period as a chance to increase empathy towards disabled people, towards the disabled population, towards the aging population, because many of the things that people were worrying about getting sick, etc., were things that disabled people have had to worry about for most of their disabled lives, right? And so, having to stay at home, having to ensure that you're not around a lot of sick people, being concerned about whether you can access healthcare, et cetera. These were all concerns that I know I have faced throughout my life. I know that many others who live in the community and are part of the community have also faced that. And so to see this current administration basically tear down all the infrastructure that we spent, as disabled advocates. I know, Tori was there, John was there. All of these folks were there having conversations with folks at the White House, on the Hill, talking about ways that we could actually expand disability policy into the general population, which we generally call sort of a curb cut effect, right? You provide a policy that was initially targeting a specific population, but you find out that that actually helps a wider population, just like Tori said earlier. And so that was a lot of the work that I was working on during the Biden administration was, talking to DOL about worker safety rights and ensuring that we reduce the transmission of certain diseases, particularly within warehouses and other congested areas where people could get sick. Because interestingly enough, there are no real air uh, policies when it comes to the Department of Labor and OSHA that deal with air quality control. The only place that we have any OSHA requirements on air quality is within mines. And so it was very much our intention to try to sort of socialize a lot of the policies that disabled people relied on so that we didn't have to spend so much time with administrative barriers that required us to prove that we were disabled. Now, unfortunately, just like we saw in January with the change in vaccine policies and some of the confusion around, including around the COVID vaccines, people having to prove that they had a chronic illness, having to get that doctor's note saying that they required this vaccine. Children are also going to be facing that issue as they go into schools. And, the thing is the point of public health is to protect some of the most vulnerable in our community by creating basically a community wide policy that protects everybody, right? And so you've heard of things like herd immunity, et cetera. And that's the intention of these vaccines. No vaccine is 100% going to ensure that you are not going to get X condition. However, when you have a wide proportion of a population that is vaccinated, you reduce the level of risk to everybody, including those with significant risk of getting a specific condition. And so this actually reduces the ability of individuals with disabilities, the ability to remain in community, to be able to participate in community. We have people who once could go to work and feel like that all the people at their work had the COVID vaccine, had the influenza vaccine. Workplaces were implementing these requirements, and the government had these strict, standards of suggestions for folks to get these vaccines. And so it gave a lot of people more security in being able to participate in their community and feel comfortable about going into their workplaces, going to schools, going to the grocery store. And that's all been taken away. And we've seen incidences of issues around the measles, flare-ups. I know in my home state of North Carolina, where I have a nephew who has not gotten the measles vaccine yet because he's not old enough for it. But there's an outbreak right now going on in North Carolina, and now I have to sit there worrying that my nephew might get it, as well as he is unfortunately at risk of several poor outcomes due to it because of the conditions that he was born with. So, it's really unfortunate to see the regression that we have seen. And it's not just vaccines. We've seen it in protections around individuals who have mental health disabilities. We've seen an increase, not just from one side of the political sphere, but from all sides of the political sphere, being willing to force people into treatment facilities, which a lot of people don't know, but a lot of these treatment facilities aren't well regulated. Um, and if they don't go to these treatment facilities, they could end up in jail. Um, and so, we're seeing this in blue states, we're seeing this in red states, and it's really concerning to see sort of what we tend to call the ugly laws, which were happening before the 1940s, um, reoccurring in society today, and really trying to push disabled people out of society. And I think it's along with a lot of the culture of exclusion that is happening not only to the disability community but to racial minorities and to immigrants. And it's all connected.
You really highlighted beautifully how the it's almost a wave of individualism ends up undermining a lot of the progress we made, even though things weren't perfect and there was work to be done. But the individualism has um, it further others the disability community, when, to your point, public health generally and public health processes, they're better for everyone, and it follows that curb cut effect. Um, John, I'm going to turn to you and we're going to zoom out a little bit. Your upcoming report provides a critical data-driven look at these types of healthcare shifts that we've been discussing. The alarming trends you highlight include growing distrust in public health leadership, fragmented public health infrastructure, and the marginalization of people with disabilities. Can you share and expand on a few key findings from your upcoming report?
Yeah, of course, Lily. So the report is a media review looking at 1 year of HHS actions around autism and public health. We would have loved to expand it to disability more broadly. We would have loved to look at more than just HHS and include other agencies and Congress, but it's just so much. We didn't have the time nor resources to expand it that far. But what we do find is that looking at these events, putting them in sequence, organizing by topic, there is a playbook that appears, a playbook that um, some of you on here may already be familiar with, either because you are familiar with the work of RFK and other anti-vaccine advocates, or maybe even in smoking cessation and what the smoking industry, tobacco industry uh, did in years past to push back on public health efforts around smoking cessation. So, Lily, you mentioned around growing distrust in public health, and I do want to acknowledge that that distrust didn't just begin on January 20th, 2025. Um, it's been continual. I think it's also been a blowback created by particular advocates in response to the work of the disability community, the exact kind of policies around air quality and anti-institutionalization and having people with disabilities belong in the community that Mia was talking about. Um, I'll say that vaccines have been a number one point of contention. The figures that RFK has appointed, hired, and surrounded himself with at HHS, what makes up this MAHA, quote, Make American Healthy Again, end quote, movement are the same individuals who have been pushing anti-vaccine beliefs for years, some as long as 3 decades. And they've used this playbook to create consent for these policy changes, make it seem as if the beliefs that they want out there that would make it less safe for people with disabilities to live in the community is just it is sound science, and it's not. It's pseudoscientific methodologies of some of these studies that they've proposed are consistently unsound and unethical, like we see the study that was proposed by Danish researchers in Guinea-Bissau. They've gone ahead and even taken unilateral action around policy changes. We saw the secretary unilaterally change the childhood vaccine schedule, reducing the number of diseases being recommended for children to be vaccinated against from 17 to 11. The 6 that were removed were rotavirus, COVID-19, influenza, hepatitis A, hepatitis B, and meningitis. Um, and what that means is we're going to see more patchwork systems around our public health infrastructure as states try to fill the gaps around what should and could be available and should be covered. And frankly, going a bit beyond the report, we're seeing these fragmented systems in other domains of health policy as well, like with work reporting requirements, as Tori mentioned, for Medicaid. And so it's going to be extremely difficult for people with disabilities to navigate these systems now and in the coming years. And I'll say we're also seeing less so a fragmentation, but a total shattering of our public health infrastructures and the value of expertise and lived experience. In my previous answer, I mentioned proponents of the anti-vaccine movement being appointed to the Advisory Committee on Immunization Practices and the Interagency Autism Coordinating Committee. Scientific experts and scientific expertise that have consistently sat on these advisory committees are just gone, replaced by those who have been consistently advocating against what the scientific consensus is and working with lawyers who make money off of cases challenging vaccine injuries like Aaron Siri. You also have many of these individuals working with the unregulated supplements industry as well, diverting against scientifically backed and helpful and accurate medical treatments, instead promoting quack autism treatments like chelation and hyperbaric oxygen therapy, both of which have killed autistic children in the past. In terms of lived experience, that speaks to the marginalization of people with disabilities that you flagged, Lily. It's no secret that the disability community has organizations and individuals have been pushing for disability rights for decades, have connections with the broader community and grassroots, and are in regular conversation of what our community is looking for and what it needs. And the administration has just ignored this opinion time and time again, whether it be not appointing these individuals to advisory committees or putting out regulations that would roll back protections for people with disabilities, um, like disparate impact protections or changes to 504 regulations um, with the smallest public comment window periods possible, forcing us to rush our response to try and prevent these changes. And again, with the Texas v. Kennedy lawsuit challenging 504 and the integration mandate from the Biden era HHS 504 rule. Um, And so we really hope that with this report, being able to see the playbook, being able to see how the administration and its allies um, get their anti-disability beliefs enacted into policy that hurts our community, that more people will be able to point that out, uh, defend against those changes, and spread accurate information in its stead.
Thank you, John. At various points, you each highlighted that the threats facing our community aren't new. They are rooted in our country's history of eugenics, ugly laws, and flat out ableism. John, I really liked when you used the term playbook. So we see the playbook, and like Mia said too, we've seen it before. We've seen it before as a community. With that, and with so much going on that you all talked about, if you could leave our audience with one priority to focus on in 2026, whether that's a policy intervention, a community building strategy, or a way to counter harmful rhetoric, what would you pick? Um, let's start going in reverse. So, John, we'll go to you.
Yeah, I want to jump specifically on community building. And community building in any sense, really. That could mean mutual support networks to getting tapped into grassroots advocacy, or just having people you can confide in who understand you and what you're going through. We really need this right now, given the onslaught of changes and cuts and rollbacks that we're going through. It's the only way that we're going to be prepared to push back both now and in the future, and to build a better future when we have the resources and capacity to do so. And would love to touch base with those who want to be part of those efforts of building out community. Um, yeah.
Thank you. Mia, what would you say is the number one priority to focus on for 2026?
Oh gosh, one priority. There's so many things, but I think one of the things that I tell people who may not be in the career that I am, but just want to know how to get involved, is to look in their community at um, local organizing efforts. And there are groups in local areas all across the nation who are doing great work, whether it is mutual organizing, whether it is lobbying, letter writing, other outreach efforts. And I would just say, get involved on the ground, because unfortunately the work at the federal level is not going anywhere for a while, unfortunately. We'll continue to push back. But where you're going to see real change and real pushback happen is on the ground in local areas, doing that type of work. So I always suggest go local.
I have a follow-up question for you, Mia, knowing that you have a really strong background in organizing. If I want to get involved at the local level and I have no idea where to start, how to find groups or causes, where would you start to do that?
Yeah, that's a very good question. And I would say, you know, if you have a Facebook account, just search on your Facebook. If you have a what is that neighborhood account? Oh, that neighborhood I don't know. There's a I forgot what that app is
Next
called.
door?
Next door, yeah. You can find that. There's a lot of different groups that start. You can ask your neighbors if they are involved, and if you have a relationship with them. If you're looking at sort of groups that have local sort of branches in different places, you could look at something like Indivisible. Always, you know, there's usually an indivisible somewhere nearby you. And that's a great sort of starter uh, organization to get involved in as you're getting into the swing of things.
Thank you. That's incredibly tangible and then ties in nicely with John's point about community building. And that's a way to go ahead and do that at the local level and channel energy. Tori, what about you? What do you think would be the one priority to focus on in 2026?
Yeah, I really appreciate both John and Mia's answers. And am gonna break the rule a little bit and say more than one thing. But it's all under an overarching umbrella. So the overarching umbrella is we have to fight back against these policies and this rhetoric. And I think there are three big buckets that I'd point people to that are pillars of fighting for that future where we have disability justice and where people have the autonomy and independence to live their lives the way that they want to without there being structural or other barriers. Um, so on the federal level, it's really pushing legislators to pass policies that support our community and specifically pushing legislators to rescind HR 1, which again is that bill that made these massive cuts. There are bills to rescind all of the health provisions of HR 1, which are it's incredibly important. There also is a bill that did not pass the Senate because it has a 60 vote requirement, but did have yes votes from every Democratic senator and Senator Collins and Senator Murkowski, which was a bill to rescind the HR 1 funding for ICE and reinvest that into Medicaid and SNAP, which is critically important. We cannot continue to give blank checks to ICE to terrorize our communities, especially immigrant communities, at the same time as gutting the programs that so many of us rely on. And we can push for legislation like the HCBS Access Act, which would make HCBS a mandatory program so that when states do face budget shortfalls, whether that's because of the federal government or some other situation, whether it's a natural disaster or something else, HCBS cannot continue to be the very first thing on the chopping block because people have nowhere else to turn for long-term care. The second big bucket is elevating the stories and experiences of people who rely on Medicaid or who rely on these other critical programs that we have talked about and continue to underscore why we need more investments in care, not less. And more investments across the lifespan for people with disabilities at every age, and not less. And the third kind of bucket is as state policymakers are navigating these massive federal cuts, there's so much advocacy we can do for state level solutions to ensure that the wealthiest and big corporations are paying their fair share and that money is invested into us and into our communities and into disabled people across the country. So that's really all of them. That's all of the things. But part of the reason why I say that is every person has a spot that's kind of the best fit for them. And all of these are options, and it's all building toward the work of creating this future that we all need and deserve.
I think that counted as one. So, um, thank you all so much for this rich and deeply thoughtful presentation. Across our discussion today, there were a number of different themes that came through. First, the scope and speed of recent federal changes, whether that's through HR 1 or new vaccine policies or shifts across HHS. But the theme is that these aren't abstract. They are reshaping the daily realities of disabled people, of caregivers, of families in ways that increase risk, reduce access, and heighten inequity. Mia reminded us how collapsing public health infrastructure and the reframing of illness or disability as an individual failure erode civil rights protections disabled people rely on to safely participate in public life. Tori underscored how Medicaid cuts shortened eligibility timelines and weakened staffing standards threaten the stability or even the very existence of home and community-based services. And these are services that are the backbone of independence for millions of people. And John helped us zoom out, showing how distrust in public health leadership and the sidelining of disability perspectives are converging into a systemic crisis. I wrote down the words that John used, shattering public health, because that was really poignant. Taken together, these insights highlight a critical truth. Policy decisions are never neutral. They reflect whose safety, autonomy, and well-being are valued and whose are treated as expendable. As we look toward 2026, our work must be to rebuild what has been dismantled, with a caveat there that what is being dismantled in many ways was already letting down our community and was not meeting our needs. And so as we work to rebuild and we organize and we fight, it is not to rebuild the existing public health structures we had, but it is to rebuild in a way that honors the civil rights commitments, the community-driven approaches, and truly the dignity of disabled people, and that those be at the center of that which we create moving forward. Whether that means advancing protective policy interventions, strengthening cross-movement coalitions, or actively countering harmful narratives, any of the things to work towards this year that Mia, John, and Tori so graciously shared with us. Tori, as you ended with, there is not a single pathway to do this work, but there is shared responsibility for each of us to find our piece, to be involved and engaged, to be witness to what is happening, and then to also respond, whatever that looks like for us in our own lives. So thank you so much. It was a privilege to moderate with you all, to hear your perspectives. Thank you for the work you are doing. Thank you, New America, for convening us today. And with that, Carrie, I'm going to turn it over to you.
Thank you so much to this amazing panel and to Lily for so beautifully summarizing and reflecting. And this discussion very clearly illuminated that the administration's HHS leadership over the past year has really threatened all 4 ADA pillars. So we really thank the audience for joining us today. We have a lot of work to do to live up to the promise of ADA, and let's uphold that promise together by having these conversations, listening to one another, and embracing new solutions to these problems. Thank you again for joining us.